Hello guys, good day. Welcome to Medical Friend channel. Please subscribe and do support us. Today we're going to look at the topic of distal radius fracture. The subtopics are Colles, Smith, Barton, Hutchinson, Diepunch, and pediatric distal radial fracture. The anatomy we have to know which is associated with the distal radius fracture, that are radioulnar joint, sigmoid notch, lunate fossa, and scaphoid fossa. Colles fracture. It is an extra-articular fracture which occurs at the cortical-canalis junction of distal end of radius within the 2 cm from articular surface. The fracture is dorsally displaced, dorsal angulation, and may be comminuted. Colles fracture, which accounts more than 90% in distal radial fracture. It may extend into distal radial ulnar joint with 6 displacements: impaction, lateral displacement, lateral rotation, dorsal displacement, dorsal rotation, and supination. This is the image which shows the dinner fork deformity. So these are the pictures which I have mentioned now. Mechanism of Colles fracture. The injury usually produced by fall onto palmar aspect of hand. This type often seen in elderly with osteoporotic condition. Also in postmenopausal women with osteoporotic condition. This Colles fracture associated with ulnar stellar fracture. This should be prompt an investigation for tears of the triangular fibrocartilage. Some of the complications could include compressive neuropathy, post-traumatic arthrosis, Olsman ischemic contracture. This is the X-ray image which shows the Colles fracture. Smith fracture. This fracture usually called as reverse Colles fracture because distal fragment is displaced olarly. Mechanism of injury could be fall on outstretched hand with the wrist in flexion, or in other words we could tell fall on flexed wrist with forearm fixed in supination. The Smith fracture is often described as a garden space deformity. Smith fracture deformity is classified as a dorsal prominence of the distal end of the proximal fragment, fullness of the wrist on the volar side due to the displaced distal fragment, deviation of the hand towards the radial side, as we could see the picture. This is the X-ray image of Smith fracture. Barton fracture. It is an intra-articular fracture in which rim of distal radius dorsally or olarly displaced. Olar is most common than dorsal type. Depending upon the displacement, olar Barton fracture, which is the anterior type, and dorsal Barton fracture, which is the posterior type. The first left-hand side shows a picture of mechanism for dorsal Barton fracture, and the right-hand side shows the volar Barton fracture mechanism. First, we're going to see about the mechanism of dorsal. An extreme dorsiflexion occurs at the wrist, which is accompanied by a pronating force, which results in shear and a dorsal articulating marginal fracture. In olar, it is actually thought to occur with the same mechanism as a Smith fracture with more force and loading on the wrist. Like when an extreme force in the palmar flexion occurs at the wrist, which is accompanied by a supinating force which results in shear, and olar articulating marginal fracture could occur. Hutchinson fracture, which could also called as Chaffers. It is an intra-articular fracture of radial stellar process. The injury could often result of a fall on an outstretched hand, injury with a blow to the back of the wrist, which causes a dorsiflexion, and abduction, which causes the scaphoid to compress against the radial styloid. These injuries are often associated with disruption of radioscap capitate, and other collateral ligaments can lead to lunate dislocation and scapholunate disruption. Isolated fracture of radial styloid are fairly common vehicle backfire and forcefully strike drivers on the back of the wrist. Complications such as scapholunate dislocation, osteoarthritis, and ligamentous damage. Die punch fracture, which is also known as a lunate load. It is an intra-articular fracture with displacement of the medial articular surface. The injury could occur with axial loading of the lunate, which causes an impaction fracture to the lunate facet of the radius. This fracture often occurs in isolation but can be associated injuries. Pediatric distal radial fracture. It has 5 types: buccal, green stick, complete, physial, and plastic. In buccal, the diaphysis could cause the metaphysis to buckle under the compressive forces. In green stick, when the tension side of the bone fails as it bent. Complete fracture is a fracture where it propagates through the entire bone and can occur as a spiral fracture, an oblique fracture, a transverse fracture. Physial fracture, which involves the growth plate. The distal physis is the most commonly injured physis. This type have the Salter-Harris classification. In plaster deformation, this occurs when a large amount of force is placed on bone and the bone stays in deformed position even after the force is removed, most commonly in the ulna. Primary mechanism of injury is fall on an outstretched hand. This type of fall rarely leads to intra-articular fracture, but the fracture can occur diphysial and metaphysial or at the physis. Boys have higher frequency than girls. Some of the complications in pediatric distal radial is non-union or malunion, growth plate arrest that could lead to deformity, nerve and vessel damage. Thank you.